I know there's been a little bit of a debate around whether we need to like services or invest in infrastructure. Naturally, I'll be biased because healthcare for us sits within the Nigerian Infrastructure Fund, which is established to invest in infrastructure in Nigeria. Healthcare is a key focus sector for us, so healthcare is a priority. We're very excited about it, we're passionate about it, and we're always looking for a good story, a good project to invest in. Some of the things that we have found is that, I'm sure many of the investors will say, it's hard, we can't, the good projects that are easy to invest in are just not landing on our table. And I think that we all appreciate that it's not that there aren't good doctors, good hospitals, good service providers out there who are doing good work. It's how do you get to that place where the idea is translated into a bankable project, where we can take your money as a Nigerian and put it in this project, be certain that that project is going to generate returns. Bankability has come up quite a few times. And how do we get to that? So I'm a doctor as well, so I kind of empathize with both sides. As a doctor, the patient is first. But how are we really going to turn that into an organization where I, as an investor, say, I have this amount of money, I can either put it in stock markets, which will make me some returns, or I can put it in treasury bills, which will get me a nice return for us, all Nigerians, or accept that additional extra risk and put it in a healthcare project, because that will generate some social impact as well as the financial return. So for you as the project owner, as the doctor, as that individual who has a brilliant idea, what you really need to come to the table with is, apart from this amazing story of how much impact this is going to have, is get us to see how is this translating into, at the end of the day, paying that money back. One of the things that I think Dr. Oyeyinka mentioned is data. And the data is there, and he's told me this many times. Data is there because they know where it is. But even from our work, looking at trying to develop our own projects internally, that data is not very easily accessible. But you have to find the data, because if you come with an "I think," it doesn't get you that funding that you need. So show the bankability, get your business plan together. Get people, doctors are very good at being doctors. Doctors are very good at looking after patients. Doctors are not always very good at building businesses. I'm going to invest, I'm sure there are many very competent, highly skilled people here. And whilst I would like to put my money behind you as an individual, it's hard to justify putting all my money behind one person. Because at the end of the day, I have to have a business structure that I can actually justify to myself and say, even if that one doctor who I really like and I think is brilliant wasn't there tomorrow, is that business going to stand? Our patient is still going to come. So don't just present to us some really good pediatricians or some really good surgeons. Present to us a structure of a pediatric practice that demonstrates that we have the population. In the area that we're planning to go in, we have assessed the willingness and ability to pay, and we think, given our pricing and our costs, we can come to somewhere where the money you put in can sustain our service at a quality that we want, but can at the end still extract, even if it's tiny, a little bit of money at the end to put back and say, dear investor, thank you so much for believing in us, here's your return. So that structure and that on paper thing that we can believe in, and we can take to board after board after board and investment committee after investment committee to say, he's not just a nice guy, the project actually makes sense. The second thing that I'll say before I move on, because I'm sure that there'll be lots of questions, is that one of the things for us in NSIA is skills transfer. I think it's really apt because this forum is really about diaspora and having people who trained abroad or people who've had experience and opportunity to further their learning or subspecialize in another country come back. And what I found is that many of the businesses that come with proposals obviously present that as one of the selling points. Oh, we're partnering with XYZ University, and we're partnering with these specialists from Cornell, and we're partnering with this, this super specialist from, name it, everywhere. That's nice. But let's just think to 10 years from now. We absolutely don't want to be in this room talking about further need for partnerships with Cornell and further need for partnership with, name it. How are we transferring the skill to the people who are here? How are we building that into the business so that, yes, today you have your professors from XYZ who may come back and live here, or maybe in and out, like some of the, some diasporas. But how do you translate that into skills that are transferred to local professionals? And why is that important? Diasporans are expensive. We have to pay more to convince you to come home. That affects the bottom line, because I have to pay more for you to do the same job as I would have to. I have to convince you to move your family. I have to convince you to accept a slightly different quality of life. And the way to do that is to pay you more. So we pay you more, it costs the business more. If you transfer those skills, we can say, oh, I have a 3-year, 5-year plan for transfer of skills from my awesome cardiothoracic surgeon who flies in and out and does super specialized surgery, my robotics ENT surgeon. How do we get those skills embedded in the system here so that in 5 years' time, you are an ENT robotics surgeon in Nigeria and you have your business in Nigeria. It doesn't depend on an expat coming in and out. That will make your, you can charge less. More people can come, more people can pay. For us as an investor in NSIA, we chose, or we sort of worked on a strategy of what areas within healthcare are we interested in putting our money behind. And the conversation here obviously has highlighted the importance of primary care. And whilst we completely agree, we have chosen to focus on tertiary care. That is, and the reasons for that, primary care in general needs a certain skill for an investor to, for the sweat factor and all of that to make it worth it. I think from our experience as well, the policy and regulatory environment is very hard to divorce from a successful primary care business. So whilst we still have the policy in development, whilst we still have the regulatory framework being figured out, I think today we have focused on tertiary. And I think I don't agree that we don't need the infrastructure, because even if you solve the financing side, you solve the demand, you still need to provide the services, and you do need the infrastructure to provide to get the quality. So we look mainly at service providers in tertiary care, so single specialty services, multi-specialty, some diagnostic centers. One of the projects that we've closed now and hopefully will be operational by first quarter of next year, 2 diagnostic centers, one in Kano and one in Umuahia, but they're co-located with the teaching hospitals. So that in some way is a PPP of sorts. So we've partnered with teaching hospitals. We brought the money, they brought the land, and they bring the patient flow. And we've looked at what services they have, and we've complemented it. And we are guaranteed a patient flow already. But within that PPP plan, that facility is going to belong to them at the end of the 10-year period, or however long the investment is. In that is built in some training, some transfer of skills from whoever is going to be working in that facility to some of the teaching hospital staff. These facilities are going to be independently run by independent operators. But we'll see how it all pans out over the next few years. But we've had to work in a very cooperative way to try and get the private sector to do their business in a private sector mentality, keep it efficient, keep it profitable, but at the same time, address the public sector needs.
Okay.
The last one that we will say that we're highly interested in is manufacturing, pharmaceutical manufacturing, essential medicines, generics. The space, there is a need, and that actually probably fits a bit better into just a business. It happens to be pharma, it happens to be medicine, but you can model that, I think, a little bit easier than patient-facing services.